This is an update for the 12th of July for Walker Street doctors. This is the last week that the New South Wales Government will be funding influenza vaccines for everyone over the age of 6 months. You can book in with our nurse Chelsea for flu vaccination by giving us a call on 99 55 5566. As we all know, the flu season's early and it's particularly nasty for patients that we're seeing, some of them. There were 15,000 new cases of influenza diagnosed around the country last week, but there were also 282,000 cases of COVID. So COVID is still well and truly with us, and it's still blocking vast numbers of hospital and ICU beds. So if you have flu symptoms, it's much more likely that you have COVID. Please get tested with a PCR test for both. There are still drive-through testing centres at North Ryde and Macquarie Park, and there's a walk-in centre at Royal North Shore Hospital. Alternatively, you could arrange for someone who is non-infectious to pick up a self-collected swab from our surgery for you to do at home, and then have them bring it back for us for collection by Douglas Hanley Moir. An early diagnosis is important from the contagion perspective, yes, but it's also important to avail yourself of early treatment. And this is the week that the criteria have been expanded for the 2 available antiviral medications for COVID. So Paxlovid is emerging as being the superior agent. It's 2 different medications actually. One is the antiviral and the second medication is to prolong the action of the first. Paxlovid is also the agent with the longest list of potential drug interactions, including statins, and there's now an excellent practical app produced by Liverpool University called COVID-19 iChart, which is able to inform us of any significant drug interactions that might be expected as a result of the metabolism through the same liver pathway. Lagevrio is the second medication and has fewer drug interactions, and both are contraindicated in pregnancy. These medications are expensive and they're in short supply and heavily subsidised on the PBS. The PBS criteria are now aged 50 and over and at high risk of doing badly from COVID, aged 70 and over for all patients who get COVID, and aged 18 and over for moderately or severely immunocompromised patients. You must have proven COVID, preferably on a PCR swab, and moderately symptomatic within the first 5 days of symptoms in order to access these antivirals. It's not appropriate to ask us to prescribe them for you just in case you get COVID while overseas, like we might prescribe an antibiotic. COVID winter booster, or the 4th dose, is another invaluable tool in order to boost neutralising antibodies, lessening the severity of the disease. Curiously, only 60% of adults over age 65 have actually had their 4th dose. And as of yesterday, the 4th dose is now available to anyone over the age of 30. And just before finishing, just a reminder not to delay childhood vaccinations. We've heard about the re-emergence of diphtheria in northern New South Wales in unvaccinated children, and the need for a toddler to be treated in ICU for the sake of a safe and effective vaccine. So this is a timely reminder that diphtheria and polio are not diseases of the past, but are still waiting to re-emerge if we let our herd immunity fall. I hope that update has been helpful.